Welcome. Today's FERNE educational opportunity discusses the Dizzy Emergency Department patient and the GRACE-3 guidelines which come to the rescue of the emergency clinician. My name is Edward Sloan. I'm an emergency physician from Chicago. I'm Professor Emeritus in the Department of Emergency Medicine at the University of Illinois at Chicago. I'm Medical Director for the Physician Assistant Studies Program at Dominican University, and I'm Medical Director for New Rose Healthcare Management, which helps the staff an emergency department in a safety net hospital on the south side of Chicago. Thank you to the EIM group, the group that initially supported my presentation of this information in December of 2022. I have no financial conflicts. I'm the FERNE President and Board Chair. FERNE has educated emergency clinicians for 2 decades in how to optimize the care of patients with neurological emergencies and injuries. So what is GRACE-3, the Vertigo Patient Guidelines produced by the Society for Academic Emergency Medicine? The Dizzy ED Patient and GRACE-3. These guidelines, published in Academic Emergency Medicine in 2023, included lead author Jonathan Edlow and many distinguished experts in the area of evaluating and treating patients with dizziness and vertigo. GRACE stands for the Guideline for Reasonable and Appropriate Care in the Emergency Department. These GRACE-3 guidelines are available on the SAEM site for reading, and if you need to download it, it is free and available for SAEM members or those who have purchased access to academic emergency medicine. What is the PICO format for the GRACE-3 Vertigo Patient Guideline questions? The PICO format uses P, population disease issues, I, the intervention or variable of interest, C, comparison between groups when applicable, outcome, that is, what is the outcome of the patients in each of the groups that have an intervention or do not, and lastly, the time it takes to demonstrate the outcome of interest. What is the PICO question for acute vestibular syndrome patients in the GRACE-3 Vertigo Patient Guideline? The first GRACE-3 PICO question regarding acute vestibular syndrome patients states, should adult ED patients presenting with acute vestibular syndrome undergo neuroimaging to diagnose stroke in the ED, or should some type of bedside neurological examination be used in isolation without the need for neuroimaging? If neuroimaging is required, what type? And if not, what type of bedside examination should be done? What is the PICO question for the spontaneous episodic vestibular syndrome patients in the GRACE-3 Vertigo Patient Guideline? The question related to spontaneous episodic vestibular syndrome asks, in these patients, should there be neuroimaging made to diagnose TIA, or should these patients be diagnosed with bedside examination? If yes to neuroimaging, what type? And if no, what type of bedside examination should be done? What is the PICO question for triggered episodic vestibular syndrome patients in the GRACE-3 Vertigo Patient Guideline? Regarding triggered episodic vestibular syndrome, the question is, should adult ED patients who present with TEVS undergo neuroimaging to diagnose stroke in the ED, or should they be diagnosed with some type of bedside examination without neuroimaging? If neuroimaging is to be performed, what type? And if not, what type of bedside exam should be done? What is the GRACE-3 PICO question regarding steroid use in treating patients with vertigo? The question is, should adult ED patients diagnosed with vestibular neuritis be treated with steroids? What is the GRACE-3 PICO question regarding posterior canal BPPV and the Epley maneuver? This question states, should adult ED patients diagnosed with PC-BPPV be treated with the Epley maneuver? How are the GRACE-3 recommendations graded? The GRACE-3 recommendations are based on the certainty that can be ascertained from the study type. In other words, those studies that are randomized and controlled give us the best information. And once we decide whether or not there's high or low certainty based on the study design, there may be some change based on other factors which are noted here, which might include bias or any flaws in the study type. And the final certainty rating in these GRACE-3 guidelines includes high, moderate, low, or very low certainty of the recommendation being made. How are the GRACE-3 recommendations summarized? This is a great summary poster which includes a QR code that will direct you to the information on the SAEM website, but this recommendation poster can be printed out and it includes the 15 recommendations that are made based on what type of vertigo is noted and whether or not it deals with the training of emergency care providers or the treatment of the acutely dizzy patient in the emergency department. For more information, email me at ferne.org@gmail.com. You can go to our ferne.org website or find us at FERNE.org on our social media. We have this content posted on our YouTube channel, and it's available in the small 1-minute lectures on TikTok and Instagram. You can also find us on X, Facebook, and LinkedIn. Thank you for your participation in this educational opportunity today.